Hello, veterans and families. I'm Commander Santanam. Helping Hands for ECHS is very happy to bring video number 73. This is a very interesting and a very useful video for every veteran and family who visits ECHS as a patient. Did you know that when you get a prescription, which is this is a symbol, there are a lot of abbreviations which the doctor uses in the prescription. Do you know the meaning of these abbreviations which is there in your prescription? One request, as you are watching this video in the YouTube, please hit subscribe button without hesitation. Let's start. Doctors use abbreviations routinely in prescriptions. When you complete your OPD, you get a prescription. It is quite important that all ECHS beneficiaries who meet the doctor understand these abbreviations, what they stand for, so that you are able to use these medicines safely. This video will take you through, and I'm sure you will all benefit at the end of this video. A preamble. I will compare medicines with the shoes. That is because we have our own shoes size. Your doctor prescribes the proper medicine, strength, and dosage, specially for you, according to your illness, age, weight, and other conditions. In the same way, like one shoe doesn't fit all, one prescription medicine doesn't fit all. It is quite important that we do not offer our prescription medicines to others. We should not become a doctor ourselves. Similarly, never use someone else's medicine because that person is saying he got cured. These are some of the basic safety in getting better on the use of medicines. What I'm showing you here is the printout which all of us get after we collect medicines from the ECHS pharmacy. This is a standard format of a prescription from ECHS, which consists of many parts. The top is ECHS header. The name is written is ex-serviceman contributory health scheme, etc. Below that is a important, which is patient information. This gets printed out from the system because you have taken the OPD appointment using your 64 KB card, which has all these details such as patient name, is it a primary beneficiary or the um, you know spouse or dependents, what is the mobile number which is registered, ESM name or the patient name, and what is this prescribed for? It is a CT medicine, which is continuous treatment, or a first of one off type OPD, then service number, age, rank, card number, etc. This is the patient information which gets printed here automatically. Below that is the most important aspect of it, which is the medicine is prescribed after your OPD consultation by the doctor or medical officer in the ECHS polyclinic. This consists of the following headers, subheaders. First is a nomenclature, dosage, instruction, day, PQT, IQT, and balance, BAL. Let me explain this. Nomenclature is nothing but the name of the medicine, its potency. That is, it could be 5 mg, it could be 150 mg, or it could be 1000 mg, and it could have some prefix like this. Okay. Next is the dosage, what we are supposed to take. Okay, it is very important. This is what this video is about. I will explain every one possible abbreviations which I use. These are the abbreviations which you will see. Typically, very few can make out or understand this unless we are told what is this. Instruction, it is again important. After meal, before meal, empty stomach, etc. etc. Then it is for number of days. For how many days this has been prescribed? PQT and IQT is what is the prescribed quantity and what is the issued quantity. So the difference between this will be the balance. As you will see here, for 30 days, prescribed quantity is 30. It could be 60 also. So it could be for 30 days, one. So you can see this. And supposing you have got issued quantity is 30 matching with the prescribed quantity, what is balance you have to get from ECHS pharmacy is nil or zero. If you don't get anything and you get a NA because it is not available, you will see this balance as 30. So this is what is our prescription is about. Maybe after this video, I'm sure you will take it out, your prescription, and check is there anything beyond this which is written, then you can contact me. Now I'm going to take you to these classic abbreviations which is there in our prescription. Dosage abbreviations. Let me start. Typically it is written OD or sometimes it is written Q dot D. Both are same. Let's say 1 OD. What does this 1 OD means? If the doctor writes like that, 1 OD, that means we take one tablet or capsule once a day. If it is 2 OD, obviously we will take two tablets or capsules once a day. So OD is basically with reference to once a day. This number gives you how many tablets, one tablet, two tablets, etc. Important information, typically this is to be taken once a day at the same time, whatever time that is, because then it is 24 hours. Doctor may specify, maybe you can ask him or her which time of the day it is to be taken, if it is 1 OD or 2 OD or etc. Okay, this is typically not written in our prescription. Okay, you can ask this. This will ensure, as I understand from doctors, that we get the best effect of the medicine and get well very soon. Let me take the next one. B.D. This will be a dosage abbreviation. You will see it. 1 B.B means take one tablet two times a day. Ideally, two times a day indicates it is every 12 hours. If it is taken at morning 8 a.m., the doctor has said take it at 8 a.m., then you will, second dose, second time, you will take it at 8 p.m. So it is 12 hours, the interval between this, 1 BD. Let me take the other one, TID, or it is written TDS. Both are same. 1 TDS means take one tablet three times a day. Here it is two times, 12 hours. Three times it is every 8 hours. 1 QID means take one tablet four times a day, every 6 hours. So these are quite important, which very commonly we see it in the prescription. Other thing which you see next to the medicine is the potency, sometimes written 5G, 10G, or 5 mg, 10 mg. G stands for gram, mg stands for milligram. Okay, this is in the potency, this will also be there. Okay, if somebody says take 500 mg, then it will be written 500 mg. Similarly, in certain medication, it will be written ml. It means milliliter. Let me go to the next one. You will also see H.S. What does this mean? One H.S means take one tablet at bedtime or at the time of sleeping or after dinner. Common misconception is all medicines have to be taken on full stomach. This is a misconception. This has to be, we have to ask the doctor. before you finish OPD. And also, you must check with the doctor at the end of consultation, should I take it at bedtime just before going to bed, or should I take it immediately after dinner? Both are very close to each other. That's why it is written as one H is take one at bedtime or at the time of sleeping or after dinner. AC, you will see this after that abbreviations. It will say 1 HSAC. That means it has to be taken before meals. Okay, again, I will reiterate, you must check this. When you see this abbreviation, you must check with the doctor during the OPD or when you are collecting the medicine from pharmacy. Similarly, PC means after meals. This is before meals AC, PC is after meals. Please get it checked with your doctor. LA, for certain medicines which are applied on the skin using comes out of a tube. It is called as local application. If it is written LA, that means it is locally applied in that area where the doctor is advised. Typically, I will say they are cream application. Normally, we see take 1 teaspoon 3 times daily. People take a teaspoon at home and just take one teaspoon, thinking that is teaspoon. It is not so. A teaspoon means it is 5 ml of medicine of that liquid. This is for liquid. 1 teaspoon is 5 ml. 1 tablespoonful with a capital T, I marked it, differentiating these two. Tablespoonful is 15 ml, which is basically 3 teaspoons are equivalent to 1 tablespoon. Similarly, you may see one OEZ. OEZ stands for ounce. An ounce stands for 30 ml. I would suggest don't use a measure which is available from stores than a spoon at your home, because spoons are not calibrated to teaspoon or tablespoon. This is a diagram which may be useful to you. 1 teaspoon is 5 ml. Obviously, 2 is 10 ml. 1 tablespoon is 50 ml. 2 tablespoon is 30 ml. Similarly, I've got a diagram here which will indicate ounce, half ounce is 15 ml. A full ounce is 30 ml. This is quite important to use a measure which is available. Even with the bottles, a small measure up to 15-20 ml comes free of cost. Having seen 1 OD, 1 BD, BID, etc., there is an alternate dosage abbreviation which is available, which is rather easy to understand. Unfortunately, it is not used at ECHS because the software does not support as yet. Some doctors may write it in your notebook. It's quite simple. If they write a particular, let's say aspirin 111, aspirin is just for example. That means you take one in the morning, one in the afternoon, one at night. This is basically equivalent to every 8 hours, 3 times daily, you're taking this. This is quite a useful method, easy to understand by the patients. Similarly, I will just take another example 010. That means you take that medicine, take one medicine in the afternoon only, whatever may be the dosage. It may be 1 tablet or 2 tablets, whatever may be, you take it only once in a day, that you in the afternoon. Morning and night, you do not take any medicine. Let me take the other one, half, one. By the time you can take half of the medicine in the morning, half in the afternoon, and one full tablet or capsule at night, half. Some doctors use this method also. Instead of 1010, they write X dash 0 dash X. X is equivalent to 1. That means take one in the morning, one at night. And do not take anything in the afternoon. That 0 indicates do not take. Similarly, here 0x0, you don't take anything in the morning or in the night. Wherever the X is there, you take only at that time, which is in the afternoon only. So there are two types of representing the dosage beyond what currently ECH is following, which is the first type, which is OD, BID, TID, TDS, so on and so forth. For completeness, I've given this particular format, which is used in many hospitals and by many doctors. Other important point from the medicine's perspective, when they write a medicine name, and you will see certain, you know, two letters. This is also printed on the label of the medicine. When you take 10 tablets in a one foil, and you will see this SR, CR, etc. Let me just take few examples. SR means sustained release. TR means a particular time of release. Sustained action, extended or extra release. These are few examples. So in case you come across any of these, you please ask the doctor, what does this mean? CR, what should I do, etc. It is quite important, I will reiterate, that we have to discuss with the doctor before we leave the doctor's cabin if you have any doubts. I will take an example. Metformin SR 500, very commonly used tablet which has got this prefix. This means metformin sustained release 500 mg tablet. Of course, the dosage is one in the morning, one in the night, etc. That will be also written in the format which we have already discussed. Another important thing on the tablet, or container or in the foil where the tablets are given to you, expiry date, EXP date. It will be written EXP date, December 23. What does this mean? That means you can use this medicine till the last day of December 2023, which is 31st December. Whereas you may also see use before December 23. This is different from this. This means that you can use this medicine till the last day of November 23, before December starts. Similarly, best before December 23 is the same as, so it can be used before or best before. Other common thing which we come across when you collect the medicine, you should look for this expiry dates. Expiry date is 12 months from the date of manufacturing. So this date is also printed on the medicine. Let's say if the date of manufacturing is December 2022, this means you can safely take this medicine, can be used till the last day of November 2023. So the manufacturing date 12 months from there is last day of November, which is 30th November 2023. This is another very important aspect when you collect the medicine or when you are taking medicines. Check this expiry dates either in this format or in these two formats, and especially this, how long, what is the duration from the manufacturing date the medicine is going to expire, or it can be used. I would rather say it can be safely used 12 months from that day is this. To complete it, I thought few useful questions you may like to get answers from doctor during your OPD. What is the name of the medicine being prescribed? Is it brand name or generic name? Okay, you can look at the notebook. What is the medication supposed to do? Will it cure or relieve my symptoms? A very fair question from an anxious patient. When do I take it and how do I take it? How long should I take it? Can I stop the medicine if I'm feeling better? Obviously, I'm not a doctor, but I think it is not correct. But if you have a doubt, ask the doctor. This is another important questions which people avoid asking, but we should ask because the medicine can have secondary reactions. Should I avoid alcohol or any other medicines which you are taking, or any specific food which I have to avoid, or any activity when I am taking this medicine? Very stressful activity, physical activity, it could be. So this is another important aspect in my view. We can ask the doctor for us to get well soon. The next one, what are the common side effects? The reason is some people may be allergic. So you can ask this, and you can also ask the question, what should I do if I experience a side effect? Patient responsibilities, meet the doctor for review if it is due, on time, along with reports. During the review, if you have to show self monitoring logs like diabetes or BP, share with the doctor. Always follow the prescription protocol and advice from the doctor diligently. Be transparent with the doctor on your illness, symptoms, and medical history. I will conclude this video. This has covered most commonly used useful abbreviations only, may not be complete. Ask the doctor after your OPD without hesitation and clarify your doubts. Adhere to medicine protocol as per the prescription. Doctors hold information as per the code of ethics about illness and treatment plan for the patient in confidence, and stop self medication. Thank you very much for watching this video. I'm Commander Santanam. I've got these two facilities, web portal and YouTube channel. I request you to hit the subscribe button and subscribe to my YouTube channel. If you still need help, call my mobile number. With this facility, you will get 100% of your queries answered easily. Jai Hind.